All right, good evening. You're welcome to our today's
Good evening, sir.
good evening. You're welcome to our today's tutorials. It's 9 o'clock already, so we'll start. There's no time to waste. So today we'll look at anatomy and physiology review. Anatomy and physiology review. In this review is going to be a question-oriented review where we bring out some questions, look at the questions and brainstorm and answer the question. So that's how is the review is going to be, just question oriented review. Okay, so I'll go straight to the questions without wasting time. As I say, this is an anatomy and physiology. Okay, the first question for today says, what type of blood vessels is the smallest in diameter within the cardiovascular system? What type of blood vessels is the smallest in diameter within the cardiovascular systems? A. Capillaries. B. Veins. C. Vena cava. D. Arteries. What's the answer? Can you hear me? Hello? Can you hear me? Can you hear me? Hello? Okay. So the answer to the question is A, capillaries. So why is A? Why A? The answer is A because capillaries, all the blood vessels, both the arteries and the veins, they end up in the capillaries. So that is where the actual exchange takes place. So the capillary is the smallest, the tiniest of them in terms of diameter, even the thickness, because the thickness needs to be what thin, so that there will be what exchange of what nutrients and the other things from the system, from the cells to the tissues to the blood. So the arteries and in arterioles, then capillaries, and the other end drains from capillary again to the venous, then to the veins and the what have you. So that's why the answer is A, capillary. So this capillary form what we call capillary bed, where this exchange actually takes place. So, so A is the answer. Let's look at the other option. B says veins. No, it's not. The answer is not veins because veins are larger vessels. These larger vessels returns blood to the heart. So veins are larger vessels. From the capillaries, blood that is going to the heart, from blood that is going to the heart, that is the deoxygenated blood and blood that are just basically deoxygenated blood. These ones that are going to the heart, they are drained from the capillaries to the venous, then from venous to the veins down. And whatever. So the answer is not B. C says vena cava. Vena cava is not the answer because in fact vena cava is the largest veins in the body. Vena cavas are the largest vein in the body. We have the superior vena cava, we have the inferior vena cavas. So this blood that came from the other end of the capillary and drained into the venous, from the venous to the vein, all the vein in the lower part of the body, from the heart down, from the legs and the other part of the body, they drain, they go up and enter the heart through the inferior vena cava. Whereas the one that the blood that came from the head region and what have you, they enter the heart through the what? Superior vena cava. So vena cava is the largest veins in the body, so it's not the answer. D says arteries. No, now arteries are larger than capillaries. Arteries carries blood away from the heart to the tissue to the cells. So arteries, from arteries, blood get to the arterioles. Arterioles are smaller than the arteries. It's from the arterioles that arterioles now form the what? The capillaries. So arteries are larger than the what? Capillaries. So the answer to this question is what? Is A, capillaries. The answer to this question is A, capillaries. Okay. Let's go to the next question. The next question says, which blood group has A antigens on erythrocytes and anti-B antibodies in plasma? Which blood group has A antigens on the on the electrolytes and anti-B antibodies on in the plasma? Okay. Then look at the correct answer. The option A says group A, group B, sorry. Option B says group A. Option C says group AB. Option D says group O. So what is the answer? What is the answer to this question? Excuse me. What is the answer to this question? What is the answer to this question? Okay. Let's look at the question again. The question is, excuse me, so I see somebody want to join us. Excuse me. Okay, you're welcome. We are looking at an anatomy and physiology review. And as I said before you join, this is review class. We'll look at questions and provide the answers and take it up from there. So we are the second question for the day. It says, which blood? Hope you can hear me. Can you hear me? Hello? Hello, can you hear me? I'm not talking to myself. Can you hear me? Hello? If you can hear me, please indicate. Can you hear me? Unmute your mic and talk. Let me be sure that you can hear me. Victor, are you there? Can you hear me? Hello? Okay. Let's continue. No time to waste. Okay, so, all right, from the question, the answer to this question is B, group A, because actually group A,
We
can
can
you
hear
hear
you,
me?
sir. Yes, sir, I can hear you now. I've tried to unmute. I was looking for you to
Okay,
call.
okay, no problems. Okay, let me go back to the question. The question says, you are not the second question for the day. The question says, which blood group, which blood group ha- which blood group has these people joining now are actually distracting us. So Ah, okay, Lucian, welcome. All right, I said the question says, the question says, the question says, which blood group? Okay, the question says, which which blood group, which blood group has antigens? The question says, which blood group has antigens, has an A antigens on electrocytes and anti-B antibodies in the plasma? Which blood group has A antigens on erythrocyte, sorry, and anti-B antibodies in the plasma? The option says option A, blood group A, option B, sorry, option A, blood group B, option B, group A, option C, group AB, option D, group O. What is the answer?
Don't
What's the
know.
answer?
I think I think it's ABO.
You think it's A? Why did you say AB? Talk to us. Why did you say AB? Hmm? Any idea? Okay, so let's not waste our time. Okay, let's go back to the question again so we can answer the question. Any idea? Hmm?
No, sir.
Huh? No
No.
idea.
No, no, no.
It's all right. It's all right. That's why we are here. All right. Actually, blood group A, blood group A has anti-A antigens and anti-B antibodies. Blood group A has A antigens and anti-B antibodies. Blood group B has B antigen, and anti-A antibodies. In fact, that's where they got their names. Blood group AB has both A and B antigens, no antibodies. Then blood group O has no antigen. That O meaning no antigen, zero antigen. But it has both antibodies, both anti-A and anti-B antibodies. Is it clear? Is it clear?
Yes,
Yes,
sir.
sir.
So that's where they got their name from. A has A antigen, B has B antigen. AB has both A and B antigens. Group O has no antigen, but group O has both antibodies. AB that have both antigens, A and B antigen, has no antibodies. Blood group B that has B antigen has anti-A antibodies, while blood group A that has A antigen has anti-B antibodies. So the answer to this question, okay, so from this my explanation, what do you think is the answer to this question?
Blood group A.
Okay.
Blood group A, yes, because blood group A has A antigens and anti-B antibodies in the plasma. It has anti-A anti-A antigens on the erythrocyte, and anti-B antibodies in the plasma. So the answer is actually what? A. Are we together?
Yes, sir.
Please mute your mic. Mute your
Yes,
mic.
sir.
Mute your mic. So you can unmute it when you want to answer question. So thank you. God bless you. All right. So now let's go to the next question for the day. The next question says, which of the following is not a recognized blood clotting factor? Which of the following is not a recognized blood clotting factor? A. Fibrinogen. B. Prothrombin. C. Ionized calcium. D. Anti-hemotic factor. What is the answer? What is the answer? What's the answer? Any idea?
No, sir.
No idea.
Is that C or D?
Victory. What do you have to say? Victory.
Sir, is it that C or D? Because the other two, A and B, is clothing factors. But I don't know for that anti-emetic
Okay.
factor.
You said that A
So
and
it's
B are
anti.
clotting factors.
I don't think is. I
Okay.
wish they say
And so
hemotic factor now. We
is
can
that
choose
a
that.
C
Maybe
or
it's C. Ionic, calcium, anti. Is that C or D?
I want this. Can someone give us a specific answer? Can someone give us a specific answer? Anybody? Anybody? I agree with you. We eliminate boots. Okay, now what is another name? Okay, let's look at the options so we don't waste our time. Just as you said, fibrinogen is a clotting factor. 1 is fibrinogen. Prothrombin, clotting factor. 2, ionized calcium is actually a clotting factor. Factor 4. But that anti-hemotic factor is just there to confuse you. Just coined name that has no meaning. It's not a standard clotting factor name. Just there to confuse you. So the answer is actually D. The answer is actually what? D. Is that clear? All right. The next question says, which leukocytes are we together?
Yes.
All right, please. The next question says, which leukocytes are the least numerous in circulation? Which leukocytes are the least numerous in circulation and are also the largest granulocytes? Which leukocytes are the least numerous in circulation and are also the largest granulocytes? Option A says monocytes. Option B says lymphocytes. Option C says basophils. Option D says neutrophils. Neutrophils. So what is the answer? These questions came from blood. Blood is a popular topic in anatomy and physiology. So I believe anybody that is doing anatomy and physiology, at least from second year, should know these questions. Very simple questions. So Who can talk to us? What do you, any idea?
Neutrophil.
Is it what?
Neutrophil.
Neutrophil. Why did you say neutrophil?
Because the least numerous leukocytes in circulation are basophil, and the largest granulocytes are eosinophil. So the combination of the two, we are going to have neutrophil.
Repeat thatness again.
The
Repeat
least
what you said.
numerous, the
Uh-huh.
least numerous leukocytes are basophil,
Okay. Mm-hmm.
and just granulocytes are eosinophil.
Eosinophils.
Uh,
So
so
yeah, so
for comparing them, the answer should be neutrophil, because neutrophils are numerous in granulocytes.
you said that neutrophils are numerous in number. Is that what you're saying?
Yes, and they are numerous in granulocytes.
Okay. Are neutrophils actually, are they granulocytes? Okay, now I like this question. This question will teach us something. Please, anytime you're answering OBJ questions, MCQ question, please read the questions, look at the options, compare the options before you can take your decisions. The option A says monocyte. So let's take this in step by step. Option A, I like what you did though, but there's something I want to point out here. Option A says
Okay.
monocytes. Even though monocytes are large, remember the question says which leukocytes are least numerous. The number is small, but each of them very large. The largest granulocyte. Of course, granulocyte have granules. We know that one now, right? Now,
Yes,
option A. Option A says monocytes. Monocytes, yes, even though monocytes are large, yes, but they are not granulocytes. True of us. Monocytes are not granulocytes. Are they? They are not. So that has ruled out option A. Lymphocytes. Lymphocyte, small, wonderful, but they are not also granulocytes. That one has ruled out option B. Option C says basophils. Just as you rightly pointed out, basophils are rare. The quantity, the number is small, but they are large granulocytes. If you watch neutrophils, neutrophils they are more abundant. But
yes,
neutrophil is not the answer because the question says the one that have least numerous. So that has ruled out option D. Is that clear? It has ruled
yes,
out option D because it says the one with least numerous. So that has ruled out option D. So the most appropriate answer to this question is option C, which is what? Basophils. Is that clear? Is
yes.
that clear? Are we together? Yes,
Option
the
C is what?
basophils.
Okay, sir.
Basophils. That
Okay,
one is the
okay.
that is the most in OBJ. You look at the most appropriate
Least
option
numerous.
because sometimes in OBJ you may look at all the options may even look alike, may even be correct. All you need to do is to look for the most appropriate option that suits the question, the context of the question. Am I communicating? So the option that suits
Yes.
that is the basophil, which is option what? B. Option what?
Option B.
B. Are we together?
Yes, sir.
Good. So let's go to the next question. The next question says, which circulating leukocytes differentiate into macrophages after migrating into the tissues? Which circulating leukocytes differentiate into macrophages after migrating into tissues? A, monocytes. B, lymphocytes. C, basophils. D, neutrophils. Let me repeat the question again. The question says, which circulating leukocyte differentiates into macrophages after migrating into tissues? A, monocytes. B, lymphocytes. C, basophils. D, neutrophils. What's the answer? What's the answer?
No idea.
Victor, are you with us? Queen Olivia, are you with us? Trevor, are you with us?
Yes, sir.
Olushola, are you with us? All right, now let's look at the question. Let's answer this question. My sister, my battery cell is about to go down. Let's answer this question so we can see how far we can go before my battery goes down totally. All right. Okay, the question says, which circulating leukocyte differentiate into macrophages after migrating into tissues? Of course, hope we know what macrophages are. Can someone talk to us? What are macrophages? What do they do? Macrophages. What do macrophages do? Have you heard of they engulf? Have you heard of endocytosis, right? Are we together?
Yes.
From the term macrophages, they engulf. Let me use a layman, this thing, they swallow, they eat up foreign bodies. Is that clear? Is that clear? That's basically what they do, just for you to understand what we are talking about. Now, the question now says, which of the leukocytes differentiate into macrophages? That is when they go to tissue, they differentiate, they turn into what? Macrophages. Which of them? Now, let's look at the options. Option A says monocytes. Actually, monocytes leave the circulation. When they leave the circulation, they go into tissue and get mature into macrophages. So monocytes actually get mature into macrophages. But let's look at the other option. Option B says lymphocyte. Lymphocytes do not become macrophages. No. C says basophils. Basophils do not differentiate into macrophages. D says neutrophils. Neutrophils do not mature into macrophages. In fact, neutrophils are even short-lived. Their lifespan is even short, so they don't not mature into macrophages. So the leukocyte that mature into macrophages is what? The monocytes are the monocytes. They leave the circulation, migrate to the tissue, and mature there into macrophages. Is that clear? So the answer to this question is option A, which is what? Monocyte. Monocyte. Option A, which is what? Monocytes. Okay. My battery is 8%, and I don't want the system to go off. I don't know why they did not give us light today. Please, I want to
Okay.
stop here, but before I stop, please, if you are here and if you are here and you do not you do not receive the link for this lecture directly from me, please chat me up on WhatsApp so that you'll be getting updates if you have my WhatsApp line. If you don't have my WhatsApp line, I will let me see if I can type it here so that you can chat me up so I can link you up so that whenever the link for this tutorials comes up, you get the link directly. Is that clear?
Yes, sir.
Okay, let's call it. The WhatsApp line is 070 1294 070 1294 5891 070 1294 5891 070 1294 5891. Chat me up immediately so that I can link you up so that whenever we post link for this lecture, you get it on time and join the class. Please, I will stop here.
Hello, sir. Ṣọlá ó ní bátìrì wọn ti lò. Ó ní pò máa stop for now. Àwọn